Hi, today's topic is anoxia and neuronal linkage. When oxygen disappears, neurons start dying within a minute. Anoxia is not just oxygen loss, it's a silent neurological emergency that shuts down the brain energy, damages synapses, and can change memory, movement, consciousness, and survival. The other aspects that are involved is the lack of energy supply, ion pumps failure, calcium overload, glutamate become toxic, and brain communication network begins to collapse. Hi, my name is Dr. Vyas, and today we're going to discuss anoxia and neuronal linkage. That starts with the oxygen loss causing the ATP failure, glutamate excess in the brain, calcium overload due to pump failure, and cell injury. Anoxia represent as the absence of oxygen supply in the tissue. Brain anoxia directly injures neurons. Neuronal mechanism is ATP failure, ion pump failure, depolarization, glutamate excitotoxicity, calcium overload, mitochondrial damage, neuronal death. These are the few aspects of anoxia. Disease description. Cerebral anoxia is oxygen deprivation affecting the brain. The brain has high oxygen demand and limited energy reserve. Irreversible neuronal injury can occur rapidly if the oxygen and blood flow are not restored. Common causes: cardiac arrest, airway obstruction, drowning, respiratory failure, carbon monoxide poisoning, shock, severe blood loss, severe anemia, and impaired oxygen transport. Type of anoxia: anoxia, anoxic anoxia, anemic anoxia, stagnant ischemic anoxia, and histotoxic anemia. That leads to loss or low oxygen enters the blood. Blood cannot carry oxygen well. Blood flow to the brain is reduced. Cell cannot use oxygen properly. The examples are here. You can see. Regardless of causes, neurons are injured when oxygen-dependent ATP production fails. Neuronal mechanism: oxygen absence or oxygen deprivation in patients, decrease oxidative phosphorylation, decrease ATP, sodium potassium pump failure, neuronal depolarization, glutamate release or glutamate excitotoxicity, and involvement of NMDA and AMPA uh, overactivation. Energy failure, ATP depletion stop energy dependent ion pumps. NMDA AMPA receptor become over activated, calcium and sodium enter the neurons. Calcium activate proteases and lipases. Free radicals increases like negative oxygen species that damage the neurons. And the clinical output of anoxia, confusion, seizures, common coma, memory loss, motor deficit, brain death in severe cases. Cell injury cascade: calcium and flux become increases that leads to mitochondrial failure. Uh, the loss or negative oxygen species causes the stress on the brain cells. Membrane plus DNA injury, inflammation or edema, apoptosis or necrosis might occur in the neuron. That leads to brain edema and intracranial pressure increases and worsened perfusion. Reperfusion after oxygen restoration, the patient might be uh, follow through the protocols like high pressure chamber, filled with oxygen, uh, and other focuses on oxygenation, circulation, temperature, seizures, glucose, and brain edema control. Brain area most vulnerable: cerebral cortex, hippocampus, basal ganglia, watershed zones, white matter may also injured in the prolonged hypoxic ischemic state. Symptoms include if the cortex injury is there, confusion, coma, hippocampus injury, short-term memory problems, basal ganglia, rigidity, um, ataxic, patient become ataxic, movement disorder, weakness, and diffuse injury, seizures, coma, autonomic instability, and long-term disability. Clinical features: headache, dizziness, confusion, restlessness, poor judgment, slurred speech, incoordination, and visual disturbance in the patient. Severe features: loss of consciousness, seizure, coma, respiratory failure, cerebral edema, multi-organ injury or multi-organ failure. Long-term memory management, cognitive decline, speech problem, motor weakness, motor disorder, behavior changes, post-anoxic seizures, reduced independence. Energy treatment, ventilation if breathing is inadequate, CPR, and defibrillation if cardiac arrest occurs, rapid treatment of choking, drowning, poisoning, shock, or respiratory failure. Hospital care ICU treat carbon monoxide poisoning with high flow oxygen. Hyperbaric oxygen chamber should be there in hospitals for these kinds of patients. Correct hypoglycemia, electrolyte problem, and acidosis. Neuroprotection, seizures, manage cerebral edema, avoid prolonged hypoxic and hypotension, monitor ECG, and prevent secondary injury, fever, infection, aspiration, and metabolic derangement. Recovery and rehabilitation, neurological and rehabilitation medicine, physiotherapy, occupational therapy, speech, swallowing therapy, neuropsychology for cognition, behavior, and memory. Rehabilitation goals improve consciousness, reduce seizures, restore motility, train memory, attention, and executive function, prevent contractures, support caregiver education, and long-term care planning. Prognosis, good prognosis involves short duration, rapid restoration, early return of consciousness, no prolonged seizures or fits, stable blood pressure and oxygen levels. Poorer prognostic factors, prolonged cardiac arrest, persistent coma, severe cerebral edema, recurrent seizures, office myoclonic status, and multi-organ failure. Anoxia is a complete, near complete oxygen deprivation in the brain. Neurons rapidly fail because oxygen is required for mitochondrial ATP production. ATP depletion causes ion pump failure, like calcium increases in the neurons or in the brain cells, and NMDA and AMPA activation causes calcium overload. Clinical outcomes include confusion, seizures, coma, memory problem, motor dysfunctioning. Treatment requires rapid oxygenation, circulation support, cost correction, seizure control, ICU care. Prognosis depends on duration of oxygen deprivation, speed, resuscitation, and severity of brain injury. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases or rare stages. Thanks and regards.